Welcome back to episode 3 of Your Sexual Health, Your Power. I'm still your host, Uchenna Amadi, and I'm here with our amazing guests, Dr. Igbodike and Mrs. Unyime Etura. Quick recap. In the first episode, we talked about why sexual health is your power. In the second episode, we talked about understanding risks and early testing. Now we're going to be talking about something many people struggle with, and that is testing with confidence. Do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and on Spotify. So, Doctor, no vexo. I'm going to my sister in this episode. Yes.
That's right.
So, I liked how you talked about the SYNLAB pitching.
Yeah.
And I'm sure a lot of people heard that as well. So, please go do your tests. So now I want to ask, what are some of the biggest fears people have about getting tested for STIs? Because Doctor was even talking in the episode 1 when he said, you see somebody going to buy condom and he's saying, do you have plates to probably hide it? And then I said that some wicked salespeople or the people at the cashier will now say, hey, bring it, 2 packs. So now I'm asking, what are the biggest fears from your experience to being, client-facing as the regional operations manager? Yeah. So what are their biggest fears of getting tested?
Okay. Thank you very much. One of the biggest fears people have, I would say number 1 is confidentiality. Because they are like, okay, people will get to know I came to do this test.
Yes.
And then I would say the second fear is the fear of the unknown. They have this fear of, what would the outcome be? What would my result be? I think those are the 2 fears people largely have. And in SYNLAB, we've addressed those fears.
Okay. How so?
You come in to do a test in SYNLAB, confidentiality for us is key. We have, for the pitching packages, we have people come in and they want to do the test anonymously. Meaning they come in, they don't give their names. Rather, they'll give an alias or their phone number instead of their names. So that gives them that, confidentiality. Okay, this person, even the person taking my sample, doesn't know me. And then in getting their results, they have access to a part provider portal where only they have the password and the username, the login, to see their results. Then we also, to boost their confidence, pre-testing and even post-testing, we have in-house pathologists that could do some sort of counseling, speak with them, explain the reason for some of this testing, the benefit of doing some of this testing. Yeah. So that's one of the things we've put in place to make sure they can come in and they know they are safe.
I can relate to the second part where you talked about the fear of the unknown.
Yeah.
So I am a bench scientist. And then you run this some of these infective tests, and maybe you're not very careful when you're uncapping the tubes, and then the sample just jumps up.
Yeah.
And you're like, okay, so let me just check if I am fine. See that waiting period there? Hey!
Yeah.
Even though you know that you're clean,
you're fine, but
or your heart will be pumping, because so I think I can relate to that. I think, but I'm it's impressive to know that there are some measures that SYNLAB has put in place
the
for
counseling sessions,
anonymous testing, and even to boost your confidence.
Yeah.
Doc, is there anything you want to add?
No, it's good. But, one thing that is very important is the issue of this counseling, pre and post.
Yeah.
I will always say, let's use an example, HIV positive patient. You screen the woman and you did not tell her about the possible outcomes. And of course, the management protocol of a patient that is HIV positive and how she can live her life. It might be quite devastating if there is no counseling at all, and you just say, "Madam, we are very sorry you are HIV positive." Goodness gracious, the patient can do all sorts of
die from there.
So that counseling is
very key,
very, very important.
Very key.
Yeah.
Okay, so Unyime, you've talked about how SYNLAB ensures confidentiality, during the testing. Is there anything you want to add about the comfort?
Oh, yeah. SYNLAB, we are a customer-centric organization, meaning it's all about the client. You walk into any of our facility, you have, you know what our ambience looks like, how the place, what it looks like. You have that comfortable space where you sit. Then when the phlebotomist or the front desk officer wants to interact with you, you're taken into a room where it's just you and the phlebotomist, no other person. So you have your discussions there, the forms are filled out there, you pick out your test there, it's being keyed into the system in there. So there's that enclosed, just you and the person. Even when you're seeing a pathologist, it's just you and the doctor, in the consulting room, So there's that comfort and boost of, whatever I say here, stays in here. It's not out. And we've made, our facility plays a key role, like I said earlier on. It's so comfortable. We've had people that are coming and they're like, they do whatever they have to do. They're like, please, can I sit and wait more minutes, more hours, We make sure they are comfortable. Like you said, coming to me or to SYNLAB is very important that a client's well-being starts with the first impression they have. You don't want to step into a place and you're like, would they meet my needs? Would they solve my problem?
And you're uncertain.
Or, you're uncertain, so our ambience, our staff, the staffs we have, they are well-trained, so competent. They know what to do, and the confidentiality thing being key.
Yeah. So I want you to just paint a scenario. So for our listeners, because I know some of them will be coming for this pitchy test. So can you just walk us through what the experience of a pitchy test looks from start to finish? So I come, let's say I'm the client.
Yeah.
I'm not the client though.
Know your status.
Don't go through the corners. They are hitting me. Well, let's say I'm the client.
Yeah.
And I come in and you're attending to me. So what would the flow be like?
You approach a facility, the client walks in to the facility, the front desk officer welcomes the client, sits the client down. And we don't do this thing of just shouting over the table, "Oh, welcome, sir. How may we help you?" No. They go close to the client.
Somebody did that thing to me. Not in SYNLAB. They say, "Mr. Amadi, come for your pregnancy result."
So for us, that's a big no.
Yeah.
So they walk to where the client is, because some people walking in, it might be they're there for inquiries, they might be there for results, maybe they've done a test before. So they walk close to the client and communicate in such a way that is just audible between the staff and the client. Welcome. How may I help you? What are you here for? Some we've had situations where the clients are just like, I'm here to do ABC. I'm here to do XYZ.
Nice.
But like I said, thank God for the training we've given to our team members, so they are able they can catch what the person wants. They're like, that's what he wants. They'll quickly scribble it down on a writing pad, check the price, communicate with them the price. Then there's a requisition form which they fill out. There's also a confidentiality form for the HIV tests, which, because a lot of people these days, we're in the digital age, they want their results to be mailed. So we have that confidentiality form where you sign, giving us the authorization to mail your result. You confirm your details, you confirm your email, you're set up on a PAP provider portal. Because why we do the confidentiality thing is that's for the HIV. We have hackers. If someone hacks into your mail, all of that. So at least you're looking at the form, you're confirming your email, you spell out your email, this is your email. So when we register you, we go ahead, register you on our portal, and there the patient actually gets a confirmation via WhatsApp or a text message. Uchenna Amadi, this is the email. So if there's any mistake in the demographs, there you correct it before your sample is taken.
Yeah.
Then the client, like I said, all this happens in an enclosed space, the phlebotomy room. The client then sample is being taken. We take your sample according to the test you've picked, the Peachy series you've picked. Take your sample. The sample bottles are labeled. The client confirms his or her name. After taking the sample, the phlebotomy shows the clients the bottle, well-labeled bottle. You have to confirm your name before stepping out of that room.
Yes.
But we don't want a situation of, I'm not sure if this was my sample. Maybe there was a mix-up.
Yes.
So they confirm their names and, the sample collection is done, they leave our facility. Most of the tests, the result is ready between 3 hours to about 12 hours, depending on what test the pick.
Because I was about to ask you, how quickly can they get
their
results?
Yeah.
Because of that waiting time, somebody's has to just be
palpitating. The turnaround time is being communicated to them when they come for the testing. Beginning. So they have the idea of what the waiting period would be. Okay. So depending on the test, there are some tests that are 3 hours, there are some that are 6 hours, 8 hours, 12 hours. There are actually some that are like 48 hours, 72 hours, like the PCR testing.
Okay.
Like the Peachy Premium I mentioned, the Peachy Premium, it's for all the STIs in that package, it's molecular testing.
Okay.
That's, the PCR method for everything, T, vaginalis, gonorrhea, chlamydia. So that actually takes about 48 hours. So we communicate the TAT, the client is fine with it, samples are taken, samples, labeling, confirm, the leave our facility, and sample analysis starts immediately. Every time each result is ready, they get a notification. Log into your part provider, a result is ready.
Nice.
Log in, all your results are ready, but they get a notification via WhatsApp or SMS, and they log in and see their results. So if they need to speak with a doctor, because there are some of them, they actually have their doctors.
Yes.
So even after doing the test, they go back to their doctors with their results for the post-counseling.
Yeah.
Or there are some that actually, at the point of ordering the test, they need to speak with our pathologist. So they inform us. So immediately the result is ready, a pathologist gets to call them within 30 minutes. Call them virtually, or they actually walk in for a physical post-counseling.
Okay, because, again, like you read my mind. Because I was going to ask, and you've mentioned this before, that there is a counseling support service, pre and post.
Yeah.
But how readily available are these pathologists or these doctors, and how do they get to, is it that during the requests of the tests, they tell you, I want to speak with them, or is it when they get it, they call to tell you that they want to speak? I don't know if you understand.
I understand the question.
Yeah. So again, I want to paint a scenario where somebody listening to me will just go carry this SOP like this and go and apply it. I know that when they finish that pathologist, I will call this and this would happen. That's just what I'm trying to achieve.
Okay. Sorry, there's something I didn't mention earlier on.
Yeah.
Nigeria, like I said, we're in the digital age.
Yeah, sure.
We have a lot of tech savvy people. The age bracket, WHO age bracket, 15 to 45 years. So a lot of people in that age bracket, they are tech savvy.
Yeah.
So we actually have an e-commerce portal also. A lot of people go online, they Google what they want to do. They have an idea of what tests they want to do. So they go on our e-commerce portal. They can as well go, book the test, pay for it, and just walk in. Back to your question. There's some of them, they walk in, they might have their doctor already. They know what they want to do. So they just come, order for a test, get the result, go back to their doctors. There are some that at the point of walking in, they're like, okay, is there a doctor I can speak with?
Okay.
At that point, most of our locations, there are physical doctors that are there. They quickly see the doctor. Locations that we don't have a physical pathologist seated, we set up a virtual session immediately and they speak with the doctor, one or two of our doctors or consultants, and they are being guided on what to do. Apart from the client actually asking, we've had instances when they come in and they're like, oh, okay, I want to do this test XYZ. And you can actually see, that's why I said that people are so trained. We have competent staffs. You could see the person is feeling agitated, the person is looking confused, not sure what he or she wants. And they actually, some of them, they're like, okay, please, I'm just worried. I just, let me use it the
I
way.
just committed.
Let me say it the way they say it. They're like, oh, I just had unprotected sex. Or someone say, oh, I just met one girl like that I'm not sure of. Just 24 hours ago, please. So in them saying that, our staffs are okay, this person needs guidance. So they'll now say, okay, please hold on.
No judgment.
Let's guide you to a pathologist. So the pre-counseling happens physically or virtually.
That's actually refreshing to know because, again, we're talking about testing with confidence. So let me now ask, how do you encourage someone who is hesitant but knows they need to be tested? So I'll start with doctor on this one. Let's say in your course of seeing your clients as the OBGYN that you are. He said he makes women's matter his business. How do you, when they have told you these are the things I'm feeling, but they are hesitant about, because some people really don't want to know. I have somebody whose principle is what I don't know will not kill me. Yeah. So let me make her they play the go, that kind of thing. So how would you convince such person?
So such statements come from the knowledge of not knowing. Now, this sounds a bit oxymoron. You know, the person does not know the consequences of what he or she is saying, I don't want to know. All right?
Wow.
Yes. So because, and again, so when you have this type of case scenario, it calls for, again, counseling. You see, the word counseling is so central in medicine that you cannot push it away. You know, so first of all is to let the individual know the reason why she or he, because sometimes I see males, you know, but majorly females. So why she needs to be tested. Okay. For instance, I said earlier on that antenatal package, you have a situation whereby some of these are integrated, you know, is part of the antenatal, you know, screening. So hepatitis B and all that. So the patient comes and says, Doc, I don't want to be screened for HIV. So the question is that, so what about your baby? You know, what about your baby? If you don't want to be screened and you are positive, don't you think this can be transmitted to your baby? And this baby is innocent. You know,
psychology.
Then also you can also say, okay, but you have it as a point of duty that you love this man. Don't you feel he has the right to know? You know. So by the time you put all those things together, the individual start thinking, okay, maybe I really need to do this. Okay, for the hepatitis, you can say, okay, well, if you don't know this and it's in your body, by the time your eyes are turning yellow, I assure you that it has gone far. Yeah. So, you know.
This one is now blackmail.
Yeah, because you have to, like I said, the person is saying, I don't want to be tested because he or she does not even
knowledge
know.
of
Absolutely.
What they know, just about their own.
And I say, well, a matter of time, then your liver will also be infected and you have cancer of the liver. And of course, that
is mean.
You know? Yeah, but
no, but I tell you, the hard truth is good
actually.
So they don't know. Okay,
wow.
the patient that has, let's say, gonorrhea infection, and you know, thank God I remember this. People do a lot of self-medication when it comes to sexually transmitted infection. They will go to over-the-counter, get antibiotics and take. They don't know what is the management protocol. They've not seen a doctor. They've not done any laboratory testing. They are just taking medications. Wow. So these are issues. So for an individual like you have to really do what? Let the person know the consequences of not being tested. You know, and that alone, most of the time, can change the narrative. You know, so you are bringing from a place of no knowledge to a place of knowledge. And that paradigm shift is enough to do what? Change the whole, you know, essence.
Wow. What a session. Knowledge really removes fear. In this Valentine's season, remember to test with confidence by visiting any SYNLAB location. Do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and on Spotify. Stay with us. There is still more coming right up.